determinants of health, the social determinants of health, or we call here in PAHO determinants of health, it's a very important initiative from WHO. And the Commission of Social Determinants of Health examines many aspects of what they call causes of the causes. And we at PAHO, we see that's one of the biggest contributions for the social pillar of the sustainable development. Sustainable development have three pillars. Have one pillar that's the economic pillar, the other is the environmental, and the other is the social. So the economic pillar has been advanced because there are many interests in everybody knows. So you see the last crisis, how the financial institution and the world economy respond for the crisis immediately. Environment also is an area or a pillar that has advanced pretty much. So everybody knows today about climate change, everybody have a very good conscience about that. But the social pillar is the one that had advanced less in the last decades. And the social determinants of health took that and make a big advance because discuss it not only the importance of health for the social development, but also how this pillar relates to the other two. How important is health for the economic development, how important is health for the environment, and how important is environment and economy for health. So this was a pretty much important movement. Also, when we talk about these three pillars and we talk about the urban health and social determinants, we are accomplishing a very important task out of the Agenda 21. Agenda 21 is the program that came out from the meeting in Rio in '92, where 178 head of states signed a document, this important document, the Agenda 21. And for health, they asked the health people to examine 4 issues, and one of them was the urban health.
We're under a transformation. You might say it's a pendulum that's swinging back, because public health originally was environmental with water and sanitation. Then when medications and vaccines became available at that point, then it became medicalized. It became very individual based. And behavior, we realized that behaviors put people at risk. So how is it that we can change individual behavior? That swings us away from environment. So what we do with urban health is to say that we're looking at health beyond health care, right? So that means healthcare is still important, but what are those other functions? And it's all the other different sectors to be able to make that happen. I think the most fun right now is when we get public health and urban planners together.
In New York, you have 2 meetings. The first one is the 3rd Regional Forum on Health Promotion. That's a movement that starts out of the Global Conference of Health Promotion that was held in Mexico. After that, we had the same forum in Chile, in Santiago, then Rio in Brazil, and this one in New York. So it's the 3rd time we do that around the region, and we bring together all these experts and authorities that are in charge to implement health promotion in the countries. And that's the opportunity they have to examine how much the agenda has been advanced, what's the new experience they have, and also how they can move on that particular theme.
One of the things that we're looking at is we know that social determinants of health exist in a lot of communities. What we are learning is that communities don't identify these social determinants as social determinants. They are aware of the conditions, but they don't call them social determinants.
I think there are many recommendations for what is constitute urban. The first one is we need to know more about what is the implications and what is the best ways to transform cities from something that's already good, because when you have a city and have all these people together, You can give water much easily, you can access education, you can access health services. Everything together is pretty much, that's why people come to cities for more than 1,000 years. It's nothing new.
Setting a table that enables full and respectful engagement of diverse groups is an enormous challenge for all of us. If we set a table that engages relatively empowered groups, those in the health sector, for example, or government, or transport and other places, to make their contributions, there may not be a respectful place for community members, those particularly with history of social exclusion, to have their voice heard and to have that be respected. So it is an art to create a space that enables those who have power and influence already to be sitting next to and respecting the contributions of those who are typically excluded from such conversations.
I think the urban health is the one that the WHO took and make a good advancement on that. Really, when you look, this year was the urban health was the theme for the World Health Day, and everywhere in the world we have a good participation of the cities, the mayors, the health commissioners, the population, the universities, and we have many campaigns in the Caribbean. We have the Wellness Day. Around the region, many cities stop a street for make physical activities and call the attention for the importance of this. We at political level have many discussions. One of the biggest one was here in PAHO during the Direct Council. We have an important roundtable on this. All this come together in Kobe. So Kobe will be the global conference on urban health where everybody from every region will be at Kobe presenting the results they have.